Hospital leaders at BSA and Northwest Texas hospitals say caring for COVID patients is causing PTSD for some of their staff. Tonight, KAMR Local 4's Kaylee Green reports as they share their concerns for nurses and other medical professionals facing stress on the front lines during yet another surge in COVID cases.
Dr. Brian Weiss, the chief medical officer at Northwest, says he's worried about his nursing staff.
I've had the opportunity to meet with a number of them, particularly critical care nurses, over the last couple of weeks. And what I'm hearing is just the recurrent signs and symptoms of post-traumatic stress disorder, or PTSD.
Over at BSA, Dr. Lamentier has the same concerns.
PTSD, post-traumatic stress disorder, concerned about folks getting depressed, concerned about folks considering career changes because of the risk to themselves and their families.
Dr. Weiss says many nurses are treating patients through their third or fourth COVID surge, but now they're seeing younger patients.
Over the last 2 months, we've seen a number of young individuals die from the virus and leave behind young children or young families. And that's particularly devastating to a lot of our nurses.
He says staff are overworked and can't provide the level of care they would like. Dr. Weiss also says people don't understand what nurses are going through in the ICU.
What they do see is a lot of death and suffering. Right? And yet they go out in the public and they hear people say, oh, it can't be that bad, or it's really not as serious as you're saying. I think any time that we minimize the effect on these nurses and what they're seeing, we add insult to injury.
And Dr. Lamentier says most COVID patients are not vaccinated, adding to the burden in hospitals.
I think there becomes a bit of unfortunately, a bit of an apathy for folks that are saying, I don't want to get vaccinated, I don't believe in it, I don't think it will help, when there's very good data to suggest and demonstrate that it does. And that, I think, frustrates people that are taking care of patients day in and day out.
And they say many nurses are leaving to travel, retiring early, or quitting the profession altogether. Dr. Weiss says if the pandemic ended tomorrow, it would take years to rebuild the nursing staff our hospitals have lost these past 18 months. Live in studio, Kaylee Green, KAMR Local 4 News. Jackie.
Kaylee, thank you. Dr. Weiss says the PTSD and anxiety he's seeing in his staff don't just happen at work, but it also follows them home, affecting their kids and their families as well.